And you may or may not know this is a requirement by our continuing medical education department with the American Heart Association. So we'll be sharing this recording with all of our speakers. I probably won't even take 10 minutes of your time today, but we do have a few things we need to go through with you. So we're certainly looking forward to our upcoming event, February 6th. And I just want to show you a few slides. One of the things that that our programming allows us to do is to Get with the Guidelines Heart Failure. So we will be promoting that in hopes that some of our facilities might choose to join us. Right now, facility in Arkansas that is utilizing Get with the Guidelines Heart Failure, but this is the sponsoring module for our conference on February 6th. And Dr. Deswell has served on a national committees to Get with the Guidelines Heart Failure, so certainly she knows this, but wanted to just show you a little bit of information about it. It's been around since 2005 and has nearly 2 million patient records. And so across our country, almost 25% of heart failure patients who are discharged actually are from a Get with the Guidelines Heart Failure hospital. So we hope to be able to, we've got now integrated diabetes into the Get with the Guidelines Heart Failure module. So we're hopeful to be able to share some of that during our conference, because of course the guidelines and statements that are going to be shared at the conference are integrated into Get with the Guidelines Heart Failure. This kind of just gives you an idea of how data has been placed into Get with the Guidelines over the years since 2005, greatly growing each year. And so that kind of takes us to our conference, which is coming up February 6th at the Clinton Presidential Center. There are 7 continuing education credits for the day. So those of you, I believe in your speaker letter, it told you your free registration code. So I encourage any of you who are able to stay for the day, get those. I'm going to flip over here to a different page to show you the whole brochure. Right now, we have under 50 registered, but that's not surprising for this time of year. $15, just breakfast and lunch, as well as those continuing education credits. So this is a great bargain for our primary care partners, as well as our smaller hospital partners. Certainly a good opportunity for advanced practice clinicians, nurses, community health, so on and so forth. So think about who you might promote it to. I will, after this call, Audrey will actually include the promotional brochure in a reply to all of you. So in case you want to promote it to some of your colleagues who are, around the Little Rock area. I just wanted to review our agenda for the day. We will be starting up bright and early, 7:50 a.m., but really looking at the issues around heart failure, why we really need to focus on heart failure. There's so few conferences really throughout the year. AHA hasn't done a ton of them either, so I'm excited about this. We're also going to bring someone in from the Department of Health, and I don't know if Dr. Adolph, if you're able to be on, but talking about heart failure in Arkansas. And then we're going to dive into those guidelines that had an update only 2 years ago, and really look clear back to the prevention element through the management of heart failure, as well as treatment for advanced heart failure. And then that important role of primary care, because these patients will be sent back to their primary care physician and to their home hospital. And so there's really some important elements as it relates to that. You know that many of our guideline-directed treatments are medications. They are treatments, pharmacological treatments. So we'll have Dr. Doyle, our PharmD, talking to us about those treatments specifically and some of the important things for clinicians to know about that, who are handling them perhaps in the community setting. Definitely want to learn more about palliative care as it relates to heart failure. And then we'll go into some other presentations. And in fact, Eva is not able to do this presentation, and we are looking for somebody to replace her as we talk about strategies for improved education and engagement. Somebody outside of the market, but if any of you know someone who might be able to jump in there, let Kristen know. We're bringing in someone over the lunch hour at the Planning Committee's request to talk about, the issues related to healthcare in Arkansas. Medicaid expansion, all the things that relate to our public being able to get care. And I know you've seen this, but it's always good to kind of remember what all is being spoken of as you're finishing up here and thinking about your presentations. We want to really address the role of allied health, whether it be cardiac rehab, respiratory, OT, PT, any of those expertise areas as they work with our heart failure patients, as well as how we're training the community, particularly with our Medicare population, of which Don is an expert in as well. Dr. Leffler has done a lot of work out in the community and going to talk about patient compliance. And then, of course, hospitals are always thinking about the financial arena of providing heart failure care. We've got both Ed and Chandra going to work with kind of those non-traditional services for our patients. You know that AJ, and get with the guidelines, we can't leave without talking about data. I believe Kathy is actually going to have to provide this to us through video, but we're going to work on having her presentation. She uses Get with the Guidelines extensively at her hospital to improve care. And we will not leave the day without making sure we have a project to improve our heart failure community awareness. We'll be doing a social media push actually there while we're, and then we will try to get additional members of our collaborative. So it's a really kind of a packed agenda. You notice that we just give you 30 minutes there for lunch, and then we'll be right back into our content. So that is our agenda. Many of you have presented before, and you know that we do need to have a disclosure at the beginning of your presentation. And so we included here an example of what has to be included on that. Now, we also need your disclosure form. I don't have that in front of me. Audrey, will you remind us who we still need disclosure forms returned before the presentations? If you could read that list to us, please.
Yes, give me 1 second to get it up.
Sorry, I caught you off guard. You sent it to me, but I don't have it in front of me.
No, you're fine. 1 second.
And there's a little, in the letter, there was a link to a speaker survey and then also the disclosure, which you just have to, if any of you are working with any sort of funding, just if you can disclose that, that'd be great. And then you just put that also on this disclosure slide.
Okay, so far we have who we still need the disclosure forms are Kathy, Chandra, Ed, Herbert, and Muhammad.
Okay, so a few of you will put it out in the follow-up, and we just need it before you speak, but gosh, it'd be easier if I didn't have to carry one around at the event. So go ahead and send those back to us. It's fairly simple. You can even just take a picture with your phone once you've signed it, or you can send it back with an email saying I've electronically signed it, and just fill it out and send it back, and we can attach that email that verifies that we didn't sign that you did it through email. So we can make that super simple for you. A few timelines. You need to complete that survey link, and it's in this presentation, but you had it in your speaker letter as well. And then give us a little short bio and a headshot. If you don't have one, we'll hunt one up for you. Or if you have one that's on your LinkedIn or whatever, just send us your LinkedIn. Send the disclosure form, and then we just need your presentation. We'll do a thorough review across the slides, at least have the majority of it. We know you may tweak it right up to the day, but if you can send us your the bulk of your presentation by the 29th to audrey.bell@heart.org, then we can start looking at that and making sure the flow is good and if we're missing anything as it relates to our objectives. By January 29th. So that is really the content that we're required to share with all of our speakers. I believe Dr. Deswell is the only one who's traveling in by air to us. And we also have made your hotel reservation for the night before as well.
Thank you.
Other questions, concerns? If anybody wants to meet and talk content, we're happy to do that. We can set that up separately. Who has joined who I have not marked down your name?
Megan Doyle.
Thank you, Megan.
Craig Wilson.
Okay, hi, Craig. And we'll talk to you content later on as well.
I have a question. This is Leanne.
Yes.
I've been asked, because our hospital's going to have a vendor table. They do want to come, and they wanted the timeline for the vendor breaks. When
Yeah.
should they be manning the table and have people there?
We definitely want to do that before, so we're going to do that. Certainly they need to be set up the 7 to 7:50 because I think that's going to be a key time frame. Over the lunch hour, we have some little breaks, but I realize they'll probably be coming over. So I would suggest the 12 to 12:30. And let me just go back to that, the agenda. We just had it.
Okay.
So I could tell you exactly. Just for anybody else who's on, remember that the hospitals can have a table if they'd like to set one up just at the cost of, I don't know why I can't find it. All right, I'm going to pull this up from here. Does somebody have the agenda in front of them who could just read off the breaks?
Got it, Cherie.
Okay.
So it would be 7 to 7:50 during registration, 9:40 to 10, 12 to 12:30, and then 2:10 to 2:30.
Some of those are too short probably for them to come over. They could leave their table, and certainly that first one and over lunch, and then if they want to come and break down when people are leaving, or at that afternoon when they could use the breakdown time before the final session.
Okay, so really it's just the breaks in the conference, just any time. Okay, well, I had that scheduled. Okay, thanks a lot.
Now, the one thing I do need to know, if any of you will be available, we will have a faculty dinner the evening before. And so if you can let us, we'll send out a meeting notice and just accept it or not accept it if your schedule allows you to join us for dinner the night before. And we'll do it on a calendar notice so we know who can come and who can't. So we'll do that on the evening before. Other questions?
This is Kristen. I just had a comment. We held our AHA Awards Luncheon at the Clinton Presidential Center back in June. And there's a large screen behind you that your slides will be displayed on, but there's no presentation mode. So if you want us to print out your slides, or if you want to print those and bring with you, either way, if you'll just let us know. You'll have a clicker, but you may have to, just turn around occasionally and make sure that you're lined up with your slides and your presentation.
Yeah, that's a little tricky with their system. So we can print them out for you. If you're used to using the presentation mode, you'll want to have us print out the slides for you so you have them. I'm glad you said that, Kristen. So help us promote. If you have ideas of who else we can share it with, we'd sure like to get, we'd be thrilled if we could get 150 to 200. But we're pretty happy where we are right now since it's just after the holidays. But we're really looking forward to it and appreciate each of you contributing. And just let us know if there's anything else we can do. Fill out the form and give us your slides by the 29th. We'll send out this slide presentation as well as an electronic version of the promotion that you could send any colleagues if you know someone who might be interested in coming, and so that you'll have everything in front of you.
Sherry, can you hear me? Yeah, this is Herbert Hahn.
Yes.
For presentation, there is the presentation occurring on a large video monitor, or is it on a projection screen?
Kristen, do you know?
I like to use a laser pointer, and they don't work on monitors, but they do on screens.
Did the laser work there when you did your presentation?
I didn't have a laser because most of my slides were just like a hospital name and their award icon.
We'll check on that. I think we can find it.
Yeah,
I mean, it's not a critical issue, but it's just when I get, sometimes if a slide's busy or something, I worry that people's eyes are wandering all over everywhere. And if I can, give them a bouncing ball to follow, it helps.
We'll let all of you know what we find out. We'll get the specifics. Like I said, Kristen's been there in an event, but I don't think we haven't been there at an educational event, so it's a little bit different.
Very good.
We'll let you know. Thank you so much, Herbert.
Thank you.
Other questions? Well, this is we're so glad. We'll see you the next time. If you have any questions, let us know. And we're really looking forward to that. I think we can really make a difference in the care for the patients in Arkansas. And this is a first step at getting additional education to those professionals. We appreciate each of you so much. Thank you so much. Have a great afternoon.
Thank
Thank
you.
you. Bye.